As the number of people contracting the swine flu grows, so do concerns and questions about the virus.
So far in the U.S., at least 5 people have been hospitalized with the virus, and the number of confirmed cases now has risen to 66.
Here to answer some of your worries or put some of your worries at ease is Dr. Darren Waters from the Greater Mobile Urgent Care. Good morning, and thanks for being here.
Good morning. Thank you for having me.
Give us an idea of what exactly is the swine flu and how is it different from what we normally hear about during the flu season?
Correct. The swine flu, what it is basically a subtype of influenza A, H1N1. And what it is, it's the flu that's basically harbored in pigs. And what pigs do is they kind of mix their influenza virus, ours, avian virus, and it's kind of a good mix, and that comes together and just forms a different strand, of influenza.
So how is this transmitted?
This is transmitted, used to be transmitted by close contact with swine or pigs. Now we found it's antigenically a little bit different, meaning it's kind of made some gene changes where now it can be transmitted human to human.
Well, that's frightening when you think about that. So that's what we're seeing now as we talk about this pandemic of it going from human to human. Are we concerned about the folk who are traveling to Mexico? I understand that you've had a few folk who've been traveling there business-wise, and they're concerned.
Sure, and there should be a heightened awareness, but let it just be that. You know, just because you're around someone who's been to Mexico does not mean you're going to get the swine flu. You know, if somebody's symptomatic and cough and cold and aching all over, you might want to take precautions and stay away from them. But just because you're around someone from that particular area does not mean you're going to get it. And it doesn't mean you need to go to a local clinic or ER either.
And you just touched on it. What are the symptoms? What should we be looking for?
General influenza symptoms, cough, cold, aching all over. Sometimes with the swine flu, you see a little bit more nausea and diarrhea. Just general illness type symptoms. It's the same as seasonal influenza.
Now, with this being a concern right now, if you're developing those flu-like symptoms, you should really definitely follow up with your physician to make sure you don't have something else.
You should get checked, and we have the capabilities. It's the same influenza test that we've been doing all along, and if it comes back positive for influenza A, what we're doing now is we're sending it to the local health departments and letting them determine whether or not this is swine flu or not.
Are there things that we can be doing to prevent getting it ourselves, like hand washing or anything like that?
Absolutely. It's the same way to prevent, just like you prevent regular influenza. Wash your hands, use alcohol-based hand sanitizer. Stay away from, being in the close quarters with people who are ill. That's kind of how this spreads during the wintertime, is people congregate in small areas and they cough on each other. So just try to, stay away from people that are sick.
Those folks trying to stay warm in the wintertime.
Exactly.
What about some of the things that we can do as far as nutrition during this time? More vitamin C, orange juice?
Just keep yourself healthy. Good diet, good exercise. Get out and enjoy life. There's nothing really different that you do now than you would do differently with the regular flu virus.
Okay, and you know what, Dr. Waters is going to come back later on this week, so we want you to email us any questions that you may have, because here's our expert. He knows all about this, and here's the email address.
That's right. Just send it to us at the Fox 10 desk at fox10tv.com. And, of course, we'll have those questions for Dr. Waters so he can answer any concerns that you may have here on Friday.
Thank you so much.
Great, thank you.
All right, thanks for joining us.